Welcome back to the Last Visit First podcast live from Home Care 100. Thank you again to Lincoln for letting us sponsor this. My next guest, Jennifer Maxwell, CEO and co-founder of Maxwell TEC. Also very much an entrepreneur in a lot of different businesses that are represented here. Jennifer, welcome to the podcast.
Well, thank you. Thank you very much.
It's really good to have you. Why are you here?
Why am I here? Well, I would tell you that coming to this conference every year is really the innovator, the catalyst that Maxwell Tech takes and runs with every year. I feel that the Lincoln Group does a great job of culminating great C-suites and great conversations and ideas and being able to network and at an intimate level versus in a large scale conference room with a bunch of others and having the ability to talk individually and get excited about going forward and partnering with our partners.
And for all the people out there that are listening that don't ever get to come to Home Care 100 or haven't got in, do you do a booth or what do you do?
No, actually, what I love about this format is there is no booth. There is no handing out tchotchkes and trying to chase people down on a vendor floor. We're all here because we all really want to be together and we really want to move the needle in this industry, and giving us a forum to do it in a relaxed environment, I think is really key for this group.
It's awesome. And Jennifer, you represent multiple other companies besides Maxwell Tech. You're an investor in Mosai, Element 5, Levo, many other companies. How do you work those, and how do you have enough time to do that with your Maxwell Tech job?
Well, what I think was really great about our investments is we stay in the same space, right? I'm not out there trying to start up a restaurant or a department store. I'm staying focused to what is core to Maxwell Tech and Maxwell Investment Partners, and that is the post-acute care space. We love it. We want to change it. We want to make it be here when it's our turn. And the way we do that is we partner and invest and advise companies that are bringing those pieces and those elements to this post-acute space.
It's cool. Jennifer, what does Maxwell Tech do?
What do we do? So we are a tech-enabled first strategic consulting firm. And so what does that mean? That's a lot of words and a lot of acronyms. What we do is we really focus on technology in the post-acute care space. But with that, there's a strategy behind it. There's people and there's processes. With that, you have to have all three legs of that stool. If we just focus on technology, something's going to fall, right? You're either going to lose the people, the process isn't going to be there, and then the check is out the door,
Yep.
right? So people, process, and technology for that future.
Cool. And this morning there was a big discussion around home health providers and hospice providers, and they were kind of doing these stories of patients. And a lot of the stories around the patients were communication. Have you guys built anything to help with communication to patients?
Yes, our nanaCONNECT platform is a specific communication platform. It is text-based, which is very desirable in the space today. I would tell you that most of our providers are not keen on apps.
Why?
Logins and passwords.
Oh, getting a patient to download an app's pretty tough.
Yep. And then if the app gets updated and shuts you out because there's HIPAA, anything that is compliance related can shut your organization down. And so we wanted to build tech that was very simple and that was easy accessible as well. You're sitting there with your cell phone right now. I'm going to send you a text, I'm coming to see you tomorrow. Are you still going to be available after your visit? How was your visit? Tell me. Like being real time and interactive with those patients is key to better outcomes for the patient, right? But also star ratings, your staffing models, all of those things and retention with your employees. You got to communicate.
Yeah, it's interesting. One of the ladies this morning during the Home Care 100 presentation, her mom was really sick, and she was saying the nurse came in for 5 minutes. And we all know that, it's been at least 15 minutes in the home, but and she's like, they were so frustrated and they were trying to, figure out what do we do? Is 5 minutes really normal or not normal? And I was thinking about it. I was like, man, if they had that nanaCONNECT and they could send that survey to that patient and the patient would have said, hey, the nurse is only here for 5 minutes. could we have solved that problem? And so this lady's super frustrated. She's like, we didn't get what we were paying for. And she was up there on the stage telling everybody this. And I'm like, could have fixed like that. Just like that. That nanaCONNECT product would have really fixed that. What do you guys do for patients once they're discharged off home health?
Yeah, so our Reach product is really great. What it does is we know that at least 20% of patients come back naturally, right? Once you're on home health, you're going to come back again. And so how can we double that? How can we bring 40% of your patients back? By showing that you care and just saying, "Hey, we're thinking about you. How you feeling? Is there anything we can do for you?" It's as simple as that. When you think about elderly people living in their homes alone, I mean, knowing that somebody's thinking about them, that's probably the biggest compliment and the best thing that you could do for them. And when they do need you, you're going to be their first call.
It's awesome. All right. Who's with you here? Did you bring a team?
I brought Jay Duty. He's my chief operating officer. He's been with us for just about 3 years now and doing a really great job. Hopefully you guys can meet him. He's the buzz around town, so he's usually out in the lobby mingling with everybody.
I want to reach out to Maxwell Tech. How do I find you? Where do I go to get to you information and about your company, what you're doing?
Yeah. So maxwelltech.com. So maxwelltec.com. You can get a hold of us right on our website there. My personal email, jennifer@maxwelltech.com.
Perfect. And on LinkedIn? You guys are on LinkedIn?
Yes, we also are on LinkedIn.
We'll have Cole post in the show notes all your information about that. So appreciate you being here. Thank you for stopping by and being on the Last Visit First podcast.
Well, thank you very much.